This was our third trip to the same location that we went to immediately following the earthquake in January of 2010. This was our anniversary trip, if you will. And the goal of the trip, and the goal of our continuing to go visit the same facility has been to build the capacity of the local Haitian community and the local Haitian doctors and nurses to provide care for their citizenry. And this was a particularly gratifying trip because we began to see changes. We've been able, through our various trips, to bring technologies such as intraoperative x-ray through mini C-arms, which they did not have. They would do orthopedic procedures and have no idea what outcomes they were getting because they couldn't see what was going on during the surgery. We were able to bring implants and supplies for them to do procedures for patients who had hip fractures that now can walk who couldn't before. And perhaps one of the greatest accomplishments that we were able to do was to bring a sterilizer over and install and program it in French so that they could actually use it, which is a true OR sterilizer. We were able to do all of that and work with the local Haitian orthopedists, their residents, and do some training. We brought arthroscopy equipment as well. So we feel like we're elevating the quality of care. We're elevating the expectations of the physicians and nursing staff around what they can and should expect to provide to their patients. Simple patient safety areas have not been addressed, identifying the patients properly, knowing that they've got the right medications, being able to properly chart and document so that that information can be transferred, type and cross-matching of blood and blood products. All of those sorts of things that we take for granted here in the United States are not present there. So we're able to bring a lot of those concepts, and that's been very, very gratifying. And I will say that the entire team is sort of wedded to the notion of coming back and back and back and developing these relationships. The level of need is huge. 25% of the healthcare in the country is provided through an organization, Partners in Health, with whom we've been working. But this is a not-for-profit organization out of Boston that is providing healthcare for a quarter of the nation. So the demand remains huge. It's not a disaster situation like it was in January, but the numbers of patients who need help are still incredibly large. I think one of the most moving things, certainly in January when we went 2010, right immediately following the earthquake, there was a lot of destruction and disaster and a lot of sadness. There was resilience, but a lot of sadness around just the amazing loss of life and sort of the impotence and inability of you feel around being able to change that. I think this time there was really a lot of hope and a lot of relationships that had been built. And as a result of that, we received a plaque from the hospital and the medical director who runs the hospital for the Ministry of Health of Haiti, a plaque thanking us, Sutter Health, for being such a great support to the hospital and to the community that the hospital serves. And it was a presentation that was truly moving. We were virtually all in tears because it just showed the human relationship, that bonds that can be formed, the fact that just by caring enough to do something, you can make a difference. And so that's probably my greatest memory from this trip. Has been one of hope, one looking forward with a positive future, and it's one that will sustain me till the next time we go.